Hello, I'm Dr. Rajeev Kumar. I'd like to tell you about a study we recently completed on a potential new treatment for Huntington's disease. I've been waiting a long time to give hopeful information like this. Huntington's is an inherited progressive brain disease, and right now we have some treatments for the symptoms, but nothing that actually slows the disease itself. So the need for new approaches is real. Our study tested a new drug called ANX005. To understand how it works, picture the brain's connections, tiny junctions between brain cells called synapses. In Huntington's, the body's own immune system appears to mistakenly tag these connections for removal, and they get eliminated. That loss of connections is what drives the disease. ANX005 is designed to block the very first step in that process, essentially stopping the mistaken remove this signal before the damage is done. Now, this was an early stage study to test mainly safety. 28 patients received the drug for about 6 months. The main goal was to see whether it was safe and whether it actually reached its target in the brain. And in fact, it did. It did exactly as it was designed. Now, there were side effects that occurred in all patients, and we watched the patients carefully. And these mainly were rash and itchiness of the rash in most patients. And this was self-limited and went away by itself with some minor treatments. In a few patients, however, there were immune-related safety effects. So with the ongoing further treatment of this drug, safety monitoring will be important. We also saw an encouraging early hint. Patients whose immune system was more active or revved up prior to the study beginning appeared to be more stable over the study and responded better to the study medication. So I want to be careful here. This was a small study without a comparison group, but it was a very promising signal, not proof. Our next step is a larger, more rigorous trial to find out whether this approach can truly slow the progression of Huntington's disease. For a disease that has waited so long for a disease-modifying therapy, that's a hopeful direction. Now, this is the kind of research that the Movement Disorders Foundation exists to support. So I encourage you to visit the Movement Disorders Foundation website at movementdisordersfoundation.org to learn more about the research and support that the Movement Disorders Foundation works with. Thank you for your attention.